Good morning and welcome back to Wellness Wednesday. I want to first start off by thanking our Wellness Wednesday sponsors, Dasachi Sankyo, Epigenomics, Genentech, Lilly Oncology, Merck, No Shave November, Quicken Loans, Taiho Oncology, and Turtle Beach. Today, Dr. Dana Cardinas, a stage 3 colon cancer survivor, joins us to discuss ways to reduce cold sensitivity due to colorectal cancer's treatment. Welcome, Dana.
Hi, everyone. I'm Dr. Dana Cardinas. I'm a retired podiatrist, and I am a colon cancer survivor, stage 3C. I was diagnosed in January of 2018, had a colon resection, and with a large tumor in my ascending colon, so I had a colon resection, and chemo for 6 months. At the end of August, had a scan that showed I was NED, no evidence of disease, and I continue to be NED today. So great news! I just got that good news a couple of weeks ago, and I'm celebrating, and I'm hoping many of you watching this will feel inspired to be the same way, because I know you will be soon. So today's wellness topic is about icing during your oxaliplatin infusion. And it is a fairly new topic. It's just been really discussed over the past year, to be honest, about the concept of icing while you are getting your oxaliplatin infusion. And historically, this has been kind of a big no-no. Your oncologist, your oncology nurses, your infusion center nurses, they are going to tell you, stay away from anything cold. Your teachings prior to you starting chemo, they're going to say, stay away from eating anything cold, keep your mouth covered if you go into cold air, wear gloves when you get things out of the freezer. Those of you that have already gone through oxaliplatin infusions will understand that these things are true. It hurts. You get a bite with it, that glass feeling when you swallow, that kind of stuff. So historically, the idea has been avoid anything cold. But there's been some patient-driven research and kind of out-of-the-box personal clinical trials that's showing that we can make an improvement in how we feel and how we function while we're taking oxaliplatin that can improve us during the process, but also hopefully have a better long-term effect. So really the goal of explaining the icing process to you is twofold. One is it's great to be able to prevent symptoms before they happen versus alleviating those symptoms when they start to happen. So those of you that have had oxaliplatin know why we call it the devil. If you've not had it, you'll understand, unfortunately. For the majority of people that do get it, it's tough. It is really tough on our nerves. Man, it takes a toll on us. But it's a great cancer killer. So that's why it is one of the go-to drugs for colorectal cancer, because it does such a good job at killing our cancer cells. But it also does a really good job at killing our nerves. And so if we can prevent some of that neuropathy from either happening at all or just reducing it while we're going through our treatment process so that we can get through longer treatments, excellent. That would be the goal. The second goal is a better quality of life post oxaliplatin. And what I mean by that is, again, oxaliplatin, the toll that it takes can be permanent and lifelong, and it can alter your quality of life. And if we can find ways now and try things now that are not contraindicated with any other drug or won't be really harmful for any other thing that we do, it's really fairly safe. then why not try it and hope for a better long-term quality of life, which would be awesome. So, and I appreciate you guys letting me read off my notes because, as you know, chemo brain is a thing. But first, I wanted to start with explaining the difference between acute cold sensitivity neuropathy and the chronic peripheral neuropathy that we get with oxaliplatin. So the acute cold sensitivity is going to start when we get that infusion, usually the first one. For some people, it starts immediately. For some people, it'll happen at the end of that infusion or maybe within 12 hours after their first infusion. For some people, it may take a couple of infusions, but usually after the first one, you know exactly what's going on. It's that glass feeling when you swallow. If you put anything cold in your mouth, man, it burns. Some people will get sores from it. You get that cold sensitivity on your fingers to the point of you can't grab something out of the fridge, out of the freezer. You've got to have gloves on because the pain is biting. Opening the freezer just to reach in, that cold air that hits you, you breathe it in. Burns. It burns. But it can also give you a feeling like your throat's closing, and that is called a laryngospasm. That feeling of your throat closing is scary. Your throat's not closing, but your brain is telling you that you're not getting any air, even though you are. And so, again, finding ways to avoid this or reduce this is fantastic. But some people, when they get their infusions, have such severe cold sensitivity that it prevents them from getting their full course of prescribed infusions. And so reducing cold neuropathy is great for the majority of us, but for some people, it's imperative so that they can actually get through their prescribed infusion course. The second thing that we get with oxaliplatin is the chronic peripheral neuropathy. Now, let me go back to the acute cold sensitivity. I forgot to mention that's transient. It goes away. For some people, it goes away 3 days post-infusion. It always comes back the next time, but it goes away in between. For some, it will last the course, but lessen between infusions. And then for some people, it maintains the same level, but once they're done with oxaliplatin, it tapers off and they don't have that cold sensitivity anymore. Versus chronic peripheral neuropathy. This is slow in coming on. The term chronic means it's not going to come on right away. It's going to slowly build up over time, and it's going to be a longer problem. It is the tingling, the pins and needles, the burning in your fingers, in your toes, in your mouth, your cheeks, your chest. I mean, it could be anywhere that you have nerves. Some people get it in their scalp. It is obviously it is an attack on the nerves by oxaliplatin, and it is a slow growing problem, meaning you don't usually feel these symptoms until about the third infusion, roughly. Some people may not get it till their sixth infusion, but it starts at the tips of the fingers and the toes and then works its way up the extremities. So let's say for my hands, it's going to start at the tips of my hands and work its way up, and it may stop right here. It may go all the way up to your shoulder. But they call it the stocking and glove distribution because it feels like we're wearing socks and gloves all the time. But again, anywhere that you have nerves, you can have neuropathy, and it can be debilitating. And for some people, the concept of chronic neuropathy is not, oh, my feet burn or ache during the day. It's the oxaliplatin prevented me from being able to have a functional life. What I mean by functional, you can't button a shirt. Notice I'm not wearing a button shirt because my hands cannot button a shirt. They fumble. They don't do that anymore. Not that I liked button up shirts, but you know what? It's the fact that I can't do it anymore that bothers me. For some people, holding a pen. You can't hold a pen, so you switch or you modify, or you've got to change the way you write. For others, you can't hold a glass when you drink, so you switch to something that's got a handle on it so that you know you're safe when you're picking up something to drink. For others, it's when you walk. Your nerve feedback mechanism has been altered by oxaliplatin so that your stance is wider, your gait is shortened. This is safer in your brain. If you have a little wider stance and you don't stretch out as far to walk, well, that's safer to walk. So you feel like you're waddling sometimes, you feel like you walk like a toddler. All of those things, that's oxaliplatin. It gives you weakness, it gives you numbness, tingling, burning, pain, all of that. And if we can lessen that over time, that would be fantastic just by doing something simple like icing. So let's talk about what icing really means. Icing, like I said, really is just something that's been started. The discussion has been started recently. And when I say recently, within the last year, really discussing icing. There was a LifeWire member back in 2018 who did try some icing at her infusion center, and she had some good result early on, but did not really have a good protocol to follow or know how long to ice and really what to do with it. Like, how do I put it on? What do I do? When do I start it? So over that course of time, and really over the past year, members of LiveWire have been icing and have really put together some good, genuine feedback. And when I say personal clinical trials, it's just testing it out on themselves to see what works and what doesn't work. And from that, we have created this protocol. And the protocol really started with one member who wrote down exactly what she did, and we passed that along to the members. And from there, we had feedback of what worked, what didn't work, and we adjusted it from there. So, but where did this whole thing come from? Well, as you guys probably have seen, breast cancer patients will, when they have to take taxane, they lose their hair. And so that concept of wearing cooling caps has been around for quite a bit, to be honest. And so you'll see them at your infusion centers, I'm sure. There are several in mine. And the whole concept is to reduce the blood flow to the hair follicles so that that chemo drug does not cause them to lose as much hair. Well, that's the goal. Reduce the blood flow to that area so that the chemo drug doesn't affect that thing as much. It still will, but where the goal is to have it not attack it so hard. So that was the first kind of thought process of, okay, hey, well, ice might not be such a bad thing, but then we combine that with an article on preventing the painful mouth sores that can come with oxaliplatin. Not everybody gets it, but some do. And there was an article written that the patients chewed ice, and during that time frame, that prevented them from getting as many sores or mouth sores at all, which again allowed them to eat, which is huge during treatment process, so that we don't have a wasting effect. It allowed them to take some of their medications that they desperately needed to take orally, and it allowed them to continue a longer course of treatment. Then in 2019, this is the research paper that really spurred this whole thing for us to think outside the box, was chewing on ice to prevent that pain that we get to prevent the cold sensitivity. And that's when a few in the group said, hey, let's just try this. Let's just see what happens. But what would happen if we also put it on our hands and our feet so that it would help that cold sensitivity when we're reaching in for doors and opening freezers? And what about if we put it on our feet so maybe we don't get the tingling and burning of neuropathy? And so that began the trials, the personal trials of these patients that were on oxaliplatin infusions, Folfox. They tried all kinds of stuff. They were eating popsicles, chewing on ice, wrapping their entire extremities with ice, and we noticed positive effects. We noticed that this, based on their feedback, they could leave the infusion center and go get ice cream. That's unheard of. They could get things out of their freezer and not have severe burning pain in their fingers. They could drink ice water. These things were big. There was not this spasm effect that was happening. Some still had that sensation. Some still had the burning and the glass feeling of swallowing, but it only lasted for a couple of days versus 10 days. It was shortening that effect that was happening. So we said, okay, you guys, if you want to keep doing it, let's put this together. Let's kind of follow what you guys are doing. And from there, we started to notice that even that earlier onset neuropathy in the hands and the feet wasn't coming on as fast. Still getting it, but not coming on as fast. And so by doing this, we're learning as patients what is helping us to get through these oxaliplatin infusions and hopefully allow us to get the full course of treatment that we need. So the idea, though, behind this icing protocol is that most infusion centers are not going to be up to date on this. This is not in a written journal somewhere. Hopefully it's coming soon because we have a team of us that are working with oncologists in research projects, trying to find out what works and what doesn't work and hopefully get a set protocol. But you're going to need to educate your oncologists. You're going to need to educate your infusion center nurses because they may not be familiar with this idea. It is spreading around the country, this concept of icing during your oxaliplatin infusions. On Twitter, man, it was like wildfire there for a while until COVID hit. And then that took over all the conversations. But it is definitely on their brains, and they're trying it on their patients. Those that have seen it and heard us talk about it, those oncologists are giving it a try. Even my oncologist, I'm no longer getting infusions, but I sent her all the info, and she started to put this into her practice to see, okay, these patients they're having a better quality of life during infusions, and if you can change that, that's huge. So let's talk about the actual protocol itself. Again, this is not a written, researched, in publication protocol. This is the protocol that we came up with as Livewire members that is really a group compilation of those that were actively going through treatment. It all started with one person and it grew from there. So it's amazing what one person can do. Remember that. So I will tell you the most important part of the icing protocol is you've got to start the icing at least 5 to 10 minutes before oxaliplatin is started. So you're going to get your pre-meds, okay? You're going to get some hydration, all normal. You're probably going to get your leucovorin, but you want to tell your nurses that you need at least a 10-minute heads up before the oxaliplatin is started. That's key because you want to actually start reducing the blood flow to the vessels in your mouth, in your throat, to your hands and to your feet before oxaliplatin gets in, okay? So, and that's the whole concept behind icing. If we reduce blood flow to our extremity, our far extremity nerves, then the goal is that they don't take the abrupt hard hit by oxaliplatin. The goal is not to stop blood flow completely. Remember, minimize, don't stop, okay? So we're not here to frostbite. So you want to start icing about 10 minutes before your infusion. Now, how are you going to ice? Well, for icing the mouth, it's chewing on ice. It's chewing on popsicles, sucking on popsicles. It's slushies, ices. You can have ice water, but the goal is to put it in your mouth and hold it. So that's why we say chew on ice, because you're not just drinking water repeatedly over and over. You're holding it in your cheeks. You're holding it around your tongue and then chewing on that ice and slowly swallowing it. So that way everything is getting kind of that cold effect. All right. When I say you've got to do it for the duration, if your infusion is an hour and a half, then you're doing it for at least that long, plus a little longer at the end. If your infusion is 3 hours, you're doing this for 3 hours. If it's for 6 hours, you're doing it for 6 hours. But honestly, there's some break time in there, and we'll discuss that in just a second. So for your hands, you're wearing like a light glove, okay? A cotton glove or something real thin, all right? Never ice directly on the skin. And you're wrapping your hands in ice. That's the easiest way to do it. So Ziploc baggies, fill it full of ice, put it on there and wrap it up with an ace bandage or Coban. Totally works. Some people get those cooling gloves, ice gloves off of Amazon. You don't have to, but you can. There's multiple different ways that you can do this. Excuse me. If you're using Ziploc baggies, use the ice at your infusion center, or take like an igloo cooler, a small igloo cooler with you, and fill your ice baggies on your own. Totally fine to do that. But the idea is, again, start 10 minutes before your oxaliplatin infusion begins. So you've got it on your hands. Same thing for your feet. You want to wrap the top and the bottoms of your feet, again, with a light sock on. Never ice against the skin directly. And you're putting the ice on there, wrap it up with some sort of wrap, like a Coban or an ace bandage. Works great. The idea is not to put it on so tight that you lose circulation. The idea is to, again, chill those areas. But let's say that becomes so sensitive you can't do it. It's uncomfortable. Well, then move the ice to the wrists and to the ankles. And by doing this, you are reducing blood flow via the largest or the larger larger arteries that bring the blood flow into those areas. So putting the ice on your ankles and your wrists would work just fine. So we start 10 minutes before the oxaliplatin infusion, and we wait approximately 20 minutes after the oxaliplatin infusion has stopped to take everything off, stop chewing on the ice. Good rule of thumb would be when you are hooked up to your 5FU, if you're getting 5FU, if you're hooked up to that, then at that point you're probably done icing, because the amount of time between getting off of oxy, getting your 5FU push, and then getting you hooked up, you're well into 20 minutes post your oxy infusion at most centers. That's when all of that comes off. So things to remember when you are icing, particularly your mouth. If you eat a popsicle just on a regular basis and it's super cold, and you then immediately try to talk to someone, sometimes your mouth is kind of numb and your tongue is kind of just numb as well, and you slur your speech until it warms back up. Expect to have this happen when you are chewing on ice for an hour and a half or more, your speech is going to slur because everything in there is getting numb, basically. So keep that in mind. If you have extended infusions, take a break. It is not expected that someone would ice for 6 straight hours. It shouldn't happen for 6 straight hours. The idea, though, is if you start to feel too cold and it's getting uncomfortable, then you should take it off for a few minutes and then put it back on. If you have to pee, go pee. I mean, we're there for, gosh, it seems like sometimes forever, and we're getting a lot of fluids. We usually do have to pee, so don't take your ice in there with you. That's okay. Take it off, do your thing, come back, get yourself iced back up and start chewing on your ice. But again, if you have longer infusion times, you also need to leave the ice off for at least 15 to 20 minutes, about every 2 hours, just because your extremities need to reperfuse. They need a little bit more blood flow. And it's okay to do that, because if you're getting a longer infusion time, that means you're getting less oxy going in anyway at the given rate. So that's okay to do. Don't feel like you're failing. The other thing with icing is that people had said, well, I'm freezing. I've got ice on, I'm freezing. Well, put a warm blanket on anywhere you don't have ice. The idea would be preferably put that warm blanket over your chest and abdomen and lower pelvis, because that warm blanket's going to increase blood flow to those areas. And that's where we want it, because that's where our cancer is. Our cancer's not in our fingers. Our cancer's in our chest, our abdomen, our pelvis, our colon, our liver. We want that stuff to get as much blood flow as possible. So wrap your chest and your abdominal areas with warm blankets to stay nice and warm, while everything else on the extremities is nice and cold. So that's kind of the gist of the icing protocol. The whole concept of this icing protocol is that it's a beginning stage. It is getting started with a new concept that could become a change in a standard of care, which would be fantastic. But it's something that you can do, that you don't need a prescription for, that you don't have to buy expensive things for. It's literally putting ice in your mouth, on your hands, and on your feet for the given time that you're getting oxaliplatin. If that just alone by itself allows you to deal with your chemo better than what you would have, then that means you're going to make it through that treatment time frame so much better than those of us who never knew this existed. Let's talk about long term though. For some patients, oxaliplatin causes such a horrible response to their nerves that they're not able to finish, but it leaves them debilitated to the point that they can't walk, they can't use their hands, they have such severe pain that their quality of life is shot. And so again, there's no expectation that this icing will prevent your neuropathy. And please listen to that carefully. This is not a prevention of chronic neuropathy discussion. The goal is that it lessens that neuropathy. And that's what we're hoping, and that's what we're seeing with those patients that have been doing this. But we don't have the long-term data on that. And hopefully over the next year, we will have fantastic data on what icing will do more long-term neuropathy. So that's the gist of icing. Sorry. That's the gist of icing. The idea is fantastic and exciting. And if you need more information, or you'd like the written protocol, or you just want to connect with us in Livewire, go to Colontown on Facebook, Colontown Here For You, and then ask to be connected to the Livewire group, the neuropathy group. And we'll get you in, and we'll talk to you about icing, and we'll show you all the, we'll show you all the different ways that people are coming up with to ice that makes it easier for them. But know that you can start this at any point in time. It's better to start on your first infusion if you can, but if you're watching this and you're already at number 6, totally okay to start it, because we've already had people do that and they're noticing that they can deal with a cold sensitivity much better. So it's okay to start it at any point in time during your process. If you're watching this and you're done with your infusions and you didn't know about this, which is totally okay because it's brand new, and you've got neuropathy and you really like to find better ways than just taking Neurontin because that's not working, join Livewire, because icing is just the tip of the iceberg of what we discussed there. There's so many different ways that you can manage your neuropathy that we think outside the box. The goal in that group is that we're trying to help each other and we're throwing out different ideas that work for a lot of us. And so we're willing to, again, be our own clinical trials if we can find things that make our lives, our quality of life, that much better. So I hope you found this helpful, educational, and I hope it wasn't too boring for you. And if you have questions, please leave them in the comments, and I would love to get back to you as soon as possible. But again, Fight CRC and all the great communities that we have for CRC patients. I mean, I can't say enough about them and what they do for us. I've been in this community now for 2 years, and I could not love it more, and I could not love you guys more for being in it with us. And so I know some of you are watching this and you're terrified. I hope I'm giving you inspiration, and know that you can do this and you got this, and shoot for Ned, babies. You guys can do it. Y'all have a great day.
Thank you, Dana, and thank you all for joining us today. We hope you'll join us next week for more tips for wellness. Have a great Wednesday.